Did you know the overall incidence of cancer rate is not only on surge, especially in our country, but also most of the cases are detected only at a later stage. Hi, I'm Dr. Lakshmi and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss about cancer and know more about this deadly disease in our today's episode. Joining our discussion today is Dr. Bharath Vaswani, Senior Consultant Medical Oncologist and Hematologist from Yashoda Hospitals, Secunderabad. Welcome to the program, Doctor.
Hello, I am Dr. Bharath Vaswani, Senior Consultant Medical Oncologist and Hematologist practicing at Yashoda Hospital, Secunderabad.
So, Dr. Bharath, it's a matter of concern that India's cancer burden and also the mortality is on rise. So what, according to you, are the most common cancers that we see in our country and what is the burden of them?
Now, when we talk about cancer, one thing we need to understand is cancer is one of the leading causes of death in India as well as all over the world. Now, when we look into the recent cancer statistics, what is more alarming is these new cancer cases are continuing to rise, and as per as the data, by 2025, approximately 15.7 lakhs new cancer cases will be detected in India every year. What is more alarming is the mortality in these cases is also increasing. Hence, there is an urgent need for everyone to understand and take utmost action for this. Now, when we talk about common cancers in India, the most common cancer, irrespective of sex, is a breast cancer. In fact, more than 1/10 of the new cancer cases detected in India are breast cancer, and approximately 30% of all new cases in females are breast cancer. After breast cancer, the next common cancer in female is cervical cancer and then the ovarian cancer. Now, when we talk about male cancers in male, you have to divide it into urban areas and the rural areas. In urban areas, as well as in Hyderabad, the most common cancer is a lung cancer. And in rural areas, the most common cancer is head and neck cancer. After head and neck cancer, the other cancers which are more commoner in India and more so in South India are a gastrointestinal cancer, namely a stomach and the esophageal cancer.
So what, according to you, Dr. Bharath, could be potential causes which are leading to these alarming numbers of cancer, especially what we are seeing today?
Now, when we talk about the causes of cancer, the most common causes of cancer in India is lifestyle, that is tobacco and tobacco-related products. So, apart from this, the other common causes are, the most important is aging. Now, if you see the median lifespan of a individual in India, it is crossing 65 years of age. Now, as you grow older, the risk of developing cancer increases. The third and an equally important cause of cancer is what we call as hereditary. So, breast cancer and colon cancer, approximately 1/10 are due to hereditary causes. Next, an equally important cause, or which I can say it is increasing, is obesity. So, in postmenopausal women, every 3 to 5 kgs weight gain leads to some cancers like endometrial cancer and breast cancer and colon cancer also.
So I think you made a good point that lifestyle modifications not just lead to cancer, but also many other diseases. So what, according to you, are lifestyle modifications that we all should take up to prevent cancer in general, doctor?
Now, when we talk about preventive aspects in cancer, there are 3 important things that we need to consider. The first thing is weight. So you have to maintain an optimum weight. Now, the more weight gain you have, the more are the risk that you may have a high risk of developing cancer. In fact, it is said that for every 3 to 5 kgs more weight than a normal weight, you have a high incidence of gynecological cancer, especially endometrial cancer, gastrointestinal cancers and breast cancers. The second important aspect in preventing a cancer is a proper exercise. Now, a very important question is, what exactly do you understand by a exercise? So, as per as American Heart Association, a heavy exercise, 75 minutes a week, or a moderate physical activity, 150 minutes a week is optimal. The third important and the equally important aspect is the diet that we consume. Now, what is considered as an optimum diet is a difficult question to answer. But a diet which contains lot of vegetable, especially green leafy vegetable, a optimum amount of fruits is mandatory. The added advantage of having a vegetarian double diet along with a non-veg diet is a good number of antioxidants that are present in the food.
So it's like your genetics load the gun, but the lifestyle habits pull the trigger. So talking about some preventive methods, as you've mentioned, especially for cancer, doctor, what are some screening tests that we all should know, and when should one undergo these tests?
Screening is defined as checking for a cancer in a person who does not have any symptoms of cancer. There are multiple and widespread screening tests available. For females, there are two important screening tests. The most common cancer that I already told you is a breast cancer. So, mammogram, which is a special X-ray of breast to be conducted every yearly after age 40, is a guideline as per as American. Now, when you consider British guidelines, they say screening for a cancer every 2 to 3 yearly after age 50. The second and the equally important screening test is for cervical cancer. So, a pap smear to be conducted every 3 yearly from age 21 to 30. And when we do co-testing with HPV, it has to be conducted every 5 yearly up till age 65. The other screening tests which are not of common use but which may help to some extent are a ultrasound, abdomen and a CA125. When we talk about screening in males, the screening test, the most common cancer in metropolitan is a lung cancer, and which is more commoner in a smoker. So a patient with a high consumptions of smoking, so they say 20 to 30 pack years, if they are there and they have consumed in the last 15 years, then a low dose CT scan to be done every yearly. Americans, less commonly Indians, they say serum PSA value to be done every yearly after age 50, although this is a less practiced test. Apart from that, for colon cancer, conducting a colonoscopy every 10 years after age 50, these are the common screening tests that we use and which may help in detecting a cancer early and can be treated more effectively.
So I'm sure cancer research has made some remarkable progress with latest technology and some cutting-edge approach. So what are some latest innovations that we are seeing today, doctor?
Cancer is now considered as a personalized therapy. Now, when two human beings are not similar, how can the treatment in these two individuals will be similar? So here came the concept of what we call as personalized therapy. Now there are multiple new methods or new techniques which tells us about why cancer came. As I discussed before, cancer could be due to mutations in the cell. So if we can find out what were the genetic changes or mutation which led to cancer, we can give them treatment tailored to those mutations also. Now, the two most recent investigations that has led to this personalized therapy are next generation sequencing, which is a simple test done on a cancer tissue, and the new type of biopsy that we called as, which is called as liquid biopsy. Now, how do we diagnose cancer? By taking out a small piece of tissue from the suspicious part of the body. But the recent technology, we can do the same testing based only on blood. This helps us in picking the cancer early. More importantly, you can repeat this test after a short period of time to monitor the treatment properly. And the next treatment, which I think has really made a change, is what we call as immunotherapy. A basic concept about immune system in the body. When there is an infection in a body, our immune system, that is a T cells, they kill those infections. So cancer is not considered as a normal thing. So why is T cells not able to kill cancer cells? Because there are breaks in the immune system which prevents this immune system from killing cancer cells. So now there are new medications which prevents or which removes these breaks from the T cells, and T cells are able to kill the cells, cancer cells better. Now this immunotherapy has led to revolution, or I can say has led to markedly improved treatment. It has changed the way when we look into some cancers like a lung cancer, a liver cancer, a kidney cancer. Even in stage 4, with these modalities, the patient is able to live a long life, and more importantly, the quality of life is also improved. So whenever we talk about cancers in a person, the first thing we should tell them is, apart from the normal conventional chemo, we have a new modality of treatment which is called as targeted therapy. This targeted therapy includes oral tablets. This targeted therapy includes monoclonal antibody, and most importantly, what I call is as a game changer, the immunotherapy.
So it's like not one dress fits everybody. So before we wrap this episode, doctor, is there any message that you would like to share with our audience as far as cancer and its growth is concerned?
The most important message which I will say is cancer is curable if detected early. Apart from that, the second important message is prevention is better than cure. So there are 2 vaccines which are available which can prevent cancer now. One of the most common cancer in females in India is a cervix cancer, which is due to a human papilloma virus infection. So a highly effective vaccine which is present, which can totally eradicate the cancer in the next 25 years, provided each one of our girls, now we are also given in boys, can be vaccinated. The second thing is, whenever you have any warning signs or warning symptoms or something which you feel is abnormal, please consult your doctor, because this could be an early symptom or signs of cancer. So what I say is, a right treatment at the right time in a right person will always give you a right result.
So thank you, doctor. It was wonderful having you here on our program today.
Thank you.
So this brings us to the end of this episode. Remember, taking charge of your health is well within your reach. Stay informed and prioritize your health, and do join us for next week as well. Until then, take care and stay healthy. Thank you.